And we are live. Good evening. Good evening. Give everyone a chance to get in. Let me know if you guys can hear me. I always like to make sure you guys can hear me before I get started. But welcome, welcome. We have an excellent show for you this evening. Let me know if you can hear me, and also let me know where you guys are watching from. I always like to know where the viewers are watching from, different parts of the world. So as we get ready, because I'm going to introduce my guest in a moment, but our discussion this evening is about from diagnosis to destination, navigating cancer care abroad. So many of you have reached out to me, or I've just seen you in different communities that I'm a part of, where you have shared that either you're going through your cancer journey or you were recently diagnosed and it has prevented you from moving abroad plans. And that's not something that I promote. It should not stop you from living whatever life you desire, right? So, part of the reason why I decided to have this show is because I've noticed quite a few people have said, I'm going to have 5 years of treatment or stick around for this or that. And I want you to know that, the US has essentially brainwashed us in terms of thinking that it is our only option for really good healthcare. That's not true. Now, there is good healthcare here. Obviously, it is at a premium, and there are a number of other countries globally that provide excellent quality healthcare and for a fraction of the cost, anywhere from 50 to even up to 80% of the cost. So you can really get more value for your dollars. And a lot of times that care that you receive outside of the US and even outside of some of the other developed countries is a bit more inclusive of other things that you would have to pay for a la carte. Okay. So, what if your best chance at beating cancer isn't in your own country? I want you to think about that as we have this conversation. What if better treatment, fewer delays, and more compassionate care were actually available, but across the globe? So today we are sitting down with a board certified oncology nurse practitioner to talk about exactly what patients need to know when considering cancer care abroad. So, from traditional to alternative treatments, this is the kind of guidance that you can't afford to miss. I do want to level set though for today's discussion. We're not going to cover the best places for cancer care. And I've said that before on a number of interviews. The reason for that is because I do have a few videos that are already on my channel on different types of cancer, so you can review those. But when it comes to a disease like cancer, you actually cannot do a blanketed or all-inclusive video because it depends on a number of factors. It depends on the type of cancer. It depends on how you choose to treat it, whether you go traditional, chemo, radiation, maybe even some surgery or a combination of that, or holistic or alternative medicine, right? And whether you've already started your treatment versus whether you're at the beginning stages and you're going to start when you go to another country for that treatment. So, because of that, I tend to not do blanketed, these are the best countries for cancer care. Some are really great at cancer care for maybe having innovative technology or that type of thing, but it may be for a specific type of cancer. So I don't want to say a particular country is top when it comes to that. I like to specify maybe for stomach cancer or maybe for another breast cancer or something along those lines. So you can find some information on videos and even some shorts that I have on endocrine cancer, uterine cancer, and stomach cancer. And I just recently did multiple myeloma. Okay. So you can look at those and determine, and also there'll be more specific cancer videos that'll come up. A lot of times I do that because we're finding that more and more the detection test or gold seal for testing to detect cancer for specific cancers, unfortunately, when it comes to Black women or Blacks on a whole, it's falling short. So I make sure I inform you guys of that, so that if you decide to seek any treatment, it doesn't matter if it is in the US or abroad, that you are armed with the best information. You can share it with your care team so that they are aware, and that you advocate for yourself. That is really what I want to make sure you do. Advocate for yourself. And if you can't, you make sure that you get someone that can. Okay. So, welcome to my channel. I'm Dr. Natasha Ramontal, a nurse and board certified patient advocate, but I'm also known as the Medical Tourism RN. Welcome to my channel for those who have not been here, who are new, and welcome to those who always watch. Basically, I'm going to guide you through healthcare beyond borders. Okay. And I am joined by my lovely guest. I'm going to bring her on screen. Excellent. Thank you, Dr. Abby Ramontal. And Dr. Abby, why don't you say hello and give the people a little bit of an introduction? Give us your background.
Hello, everyone. I am so happy and excited to be a part of this live this evening. So, I started my oncology background a while back. So, basically, I started in 2007. I started as a baby, you could say, as a baby nurse, that's what we would call it. And over time, as I gained more knowledge in the field of oncology, I decided to go a little further and do my nurse practitioner. That I specialized in family practice, but my background was always hematology oncology. So I did a lot of emphasis on making sure that I stay in the field of oncology. It's been a very rewarding field. It can be very challenging dealing with those different types of diagnosis in regards to hematology or oncology type patients. It's a very, very broad area. However, when it comes to the diagnosis, the treatments, and just going through that cancer journey, it could be very challenging for patients and their families because most patients have to tell their families that they have a diagnosis of cancer. And everybody goes through a challenging time trying to figure out what's best, what are my options, where do I go, where do I start. So it could be a little challenging. However, I believe since I started in 2007, we're in 2025, I have had the opportunity to see how the care of cancer has evolved. And not only it has evolved here in this country, it has evolved in other countries. And patients have access to different types of medications, different types of treatment protocols that are sometimes used most here, and there are some protocols that you will find outside of this country that I truly believe has been very helpful for some of the patients that I come across. So it's been a rewarding journey and a challenging journey as well. But again, cancer care has become a field where there is so much to learn, and our treatment options have become so much better when it comes to, treating our patients.
I forgot to mention transparency, full transparency, same last name. You noticed? Dr. Abby is my sister in law. So, for those of you that don't know, Dr. Abby, let them know where you are from.
Okay, I am originally from the beautiful island of St. Lucia, the Helen of the West Indies.
Big up St. Lucia, everybody.
Yes.
So yes, thank you for that. I wanted to ask you because one of the things that you mentioned was that you've had an opportunity to see how cancer and cancer treatment has evolved over the last 20 years, almost 20 years. I
Mhm.
wanted to ask you specifically about Black women before we kind of get into some other areas. I've had a number of Black women in particular reach out to me for cancer care abroad. I was curious, although you work in the US, I wanted to know, have you noticed more patients exploring cancer care options abroad in recent years, or has that not been brought up at all?
It has been brought up many times. So, for example, we've had patients who've gone to Mexico, patients have gone to India, and patients that have gone to Turkey
Mm.
and also Colombia. Over the years, As anyone in medicine or just probably watching the news, you have noticed that our prices in healthcare has tremendously and continuously just going up. And some of our patients, they lack insurance coverage, or they do have insurances, but insurance sometimes covers a certain amount of services.
Right.
And patients have gone out to other countries to receive care. Some of them have been very successful. And then once they've reached that level where they receive the initiation part of chemotherapy agents, biotherapy, and radiation and possible surgery, then they move on to the stage of maintenance type therapies. Depending on the staging of their cancers, they've been able to come back to us because maintenance therapy is a lot cheaper, and also the maintenance therapies are not as frequent, whereas there's treatments where you have to come in every week for treatments. And when you do come in every week for treatments, you have to take into account the labs that has to be drawn and those treatment visits. Whereas when it's a maintenance agent, you come in for the lab, you do your treatment, and a month out, or sometimes 2 months out, you come in for your next treatment. So that gives the patient a little bit of peace knowing that, okay, I was able to get the basic part of treatment when it came to the initiation of treatments, getting to a level of, I wouldn't say that the patient was cured, but at least that patient got to a level where they can maintain their cancers. And sometimes they've even had to go out of the country after they're on maintenance therapy, the diagnostic testing, because you do have to follow up with diagnostic testing every 3 months. They will sometimes go outside of the country to receive those services because it's like 80% reduction in price. So that makes a difference for our patients.
That's interesting. I was going to ask you how you handled that, but before we get there, I want to talk about a little bit about why some patients are seeking treatment for cancer and other things outside of the U.S. And you mentioned affordability, which is true. I coined a term, the 3 A's of medical tourism. One of them is affordability, obviously, anywhere from 50 to even 80% less in terms of the entire treatment. And it could be the labs that you mentioned. It can be the actual treatment, depending on what it is. It can be all of the follow-up. Whereas there's usually a package when you go abroad, and it's all of those things are inclusive. Whereas in the United States, it's a la carte. It's, oh, these labs cost, and your insurance has to cover this amount, and you may still get stuck with a bill, and it's a continuous treatment. So all of that adds up. Another A is accessibility. So the accessibility kind of stems from, are you able to even get in terms of an appointment or a particular specialist, because maybe their list is so long, you're on a waiting list. Or maybe accessibility to a particular type of treatment, because there's some treatments that are cutting edge, very innovative, but they may not have been FDA approved in the US, which is something that happens, but maybe it's something that has proven to be successful in other parts of the world. So you can access that a lot more easily. And then the last A is availability. So perhaps it's just not available here in the US, similar to the last scenario where it may be something innovative, but because it's not approved in your part of the world, it's something that you would travel for because it's offered there. So accessibility, affordability, and availability is really key when you're looking at not just cancer, but any type of treatment. But cancer in particular, that treatment can be very expensive in some countries, and medical tourism can offer significant savings. So that, along with technology and procedures. So let's talk a little bit more about that. I did want to ask you, do you find that those that do travel, whether it turns out, good or bad, are they traveling back to maybe their own countries, or are they kind of looking into this and looking at a place that happens to offer particular treatments and they choose that country for that reason, or a combination?
I would say that I have seen at least 60% of patients have traveled to their home countries and roughly 40% to another country.
Wow, that is interesting. How do
Yes.
you all handle when they go to another country for treatment, come back and say the documents are in another language? But I mean, obviously, if it's just looking at levels like blood work, you
Mhm.
can see that. But in terms of things like the writing, all of the notes from the physician, all of the recommendations, all of those things, how do they kind of handle that? And also, what if just by nature of how a particular provider may have been trained, they're trained differently in another country. And so something that would have been done differently in the US, they've experienced it a different way. And now you have to sort of take over. How is that handled?
So that could be a little bit of a challenge. However, the institution that I currently work with now, they have a translating department that
Okay.
helps with those kinds of cases. For the most part, patients are told if you're going to another country and if you do choose to come back, you would have to provide all of the documents that whatever test, whatever was done, whatever treatment was utilized during your time there, you would need to present that. With technology, things have gotten a little better. So there are some of the countries where it's more developed. The
Mhm.
patients go to the facilities that possibly will use the same charting system that we use. So, for example, we use the EPIC system. I have seen where patients went to another facility outside of the country, and there is a way where we can retrieve their charts. So that makes a really big difference. You're able to actually see it yourself. You're able to go in there to really get the information that you need to. Whereas other patients would come in and they would come with their CDs. They would come they would come with like I call it a book. They come in with everything, with folders upon folders as to what was done for them. We definitely need those paperworks, the data, the different diagnostic testing that was done. We need to see that because then we need to determine, okay, where were you in your course of treatment? What was the last imaging study reflected in regards to your cancer diagnosis? So we need to have access to everything. And there's times if they do not have access, we kind of have to start from square one. We have
Mm.
to go back and try to figure out, okay, let's do this, let's do that. We really encourage the patients to make sure that you're bringing in those necessary treatment protocols that was utilized for you because there could be deviations,
Right.
different countries, different oncologies. Sometimes they're going to take out or tweak something in the treatment protocol to to give the patient that chance of life and hope.
It's so interesting you brought up the records and specifically that EMR that you mentioned. With that EMR, I know it's a lot easier. It's widely known. It has that capability. And for those of you watching, there is a video that I did on records. It's like a 5 minute or less video. Make sure you watch it because it's about how to keep your continuity of care and making sure
Mhm.
that you have access to your records, especially if you make a decision to travel abroad. There's an easy way to ensure that you seamlessly can provide that information wherever you go. Okay, so please make sure you check it out. And I'll try and put it in the chat and I'll put it in the description as well. One of the things I wanted to ask you about, Dr. Abby, was there's also a perception, when it comes to quality of
Mhm.
care. There can be variations in the quality of care in the healthcare facilities in different countries, and this can include different things, anything from staffing to the equipment to the actual procedure. Um, and then also access to things like alternative treatments. Some patients may travel abroad to seek alternative or experimental treatments not yet available, maybe in the US. There's some risks, considerations that people need to consider with the treatment, but also just with medical tourism on a whole. I know, at least in the US, it is not, or it's frowned upon when we look at something like cancer and you decide as a patient to explore alternative or types of treatment or holistic treatment. So, have you experienced some going abroad and engaging in holistic care versus the traditional chemo, radiation, etc.? And if so, how has that impacted where you all sort of take over when they come back to you?
So when it comes to that part of my job, it could be a very daunting task, and I'll tell you why. So we have patients based on the type of diagnosis that they have. Based on the data, the research, you want to gear that patient into, okay, we need to focus on traditional. And then you can move to the alternative aspect of things. But patients have the tendency to believe that chemotherapy agents, it's toxic. They're correct. It's chemicals. It affects. I Whenever I do a chemotherapy education teaching, I have to remind the patient that chemotherapy agents affects your good cells and your bad cells.
Right.
Now I'm 100% sure someone that is watching this live right now will say that chemotherapy is bad. Yes, it is. It affects your good cells and your bad cells. And then you hear the terminology that we're giving you a targeted therapy. But then you're going to tell me you're giving me a targeted therapy, but then you're going to tell me it's going to affect my good cells as well. Unfortunately, when depending on the types of cancers that we're dealing with, we're giving those treatments intravenously. It's going straight into your vein. Whenever something goes into your vein, it goes straight into your blood. So it doesn't choose where it goes into the entire body. So it's targeted therapy to a certain extent based on the drugs, how the drugs are made now. The drugs are made in a way where it works directly on a patient's genetics.
Mm-hmm.
However, it's still going to affect your good cells and your bad cells.
Sure.
So for the most part, patients, we educate patients. We do not discourage, we do not say you should not go, this is not right. Because remember, patients are adults. They're human beings. They
Mm-hmm.
think for themselves. They're doing their research. And they're under the impression that this is where I'm going, and that's okay. So we've had patients that have gone to Mexico. We've had patients that have gone to Colombia. Some patients have gone to the developed countries, for example, Europe. Some
Mm-hmm.
patients have gone to Australia. And some have come back happy, even though the outcome was not great. Some have come back, saying that was the best decision they made in their lives because, they had very good results. But we never discourage. Again, patients are adults. I always say they are awake, alert, oriented times 10 because it means that person knows what's going on. But that person also has the ability to say that I want this and I do not want that.
Right. Right. No, that makes sense. I are you in? your employment, wherever you work, are you connected to any international reputable cancer institutions or in partnership with them? Because that's another thing that I tell people to look for if they decide to go. The first place that I tell them to look into in terms of checking out the background and the accreditation of the institution is the Joint Commission International.
Mhm.
And the Joint Commission International, you can Google it, guys, you can always
Mhm.
look it up, but it has every country that goes through a rigorous accreditation process. And it'll tell you which locations, which hospitals, anywhere that offers care. And this is also outpatient facilities, laboratories, dental, it covers the gamut wherever care is provided. If they receive the Joint Commission International accreditation, that's like the gold standard internationally. Now, there are other international accrediting bodies that they may be a part of as
Mhm.
well, but I would not personally go to one that was not accredited by the Joint Commission International. Okay, so that's one place. But the other thing I tell people is if a facility happens to be in partnership with maybe an academic institution, a large academic institution in your country. That's another way to vet these facilities, because typically an organization in a academic institution in the United States is not going to share their prestigious name with just any type of facility. They are going to fall in line usually with the Joint Commission International and others to ensure that they keep their skills and accreditation up so that they can keep that partnership with the academic institution. So I did want to ask you about that, Dr. Abby.
So currently, at the moment, we're not affiliated with any outside or international type
Okay.
institutions.
No problem. Okay, no problem. I wanted to pause here. There's a question in the chat from Big Sis Dula. Hi, Big Sis Dula. Thanks for joining. Her question is, if I choose to move abroad after initial cancer treatment, do I need to return to the US for my follow-up treatment because she wants to move abroad?
It really depends on the type of cancer that you're dealing with. It really depends on whether or not the provider that you initially started with, if that provider is the provider that really means a lot to you. So the reason why I say this is we have patients who come from South America, the Caribbean islands, who they've been seeing the same provider for, I would say, at least 10 to 15 years. And they have moved abroad, they moved to other countries, and they would come back and do their follow-ups. However, if you're going to an institution in that country that you're going to be residing and they have the appropriate certifications and you have done your research, I do not see why you would have to leave and come back to the US. And the reason why I would stress on that, it's because there are so many different cancer associations and they're able to provide worldwide all the different protocols that are needed so that patients can get the right treatment and get the right follow-up care. So if you have the opportunity to come back to the US, and if you can afford it, great. But if you're not able to, then you would have to seek the right institution to be able to get the best follow-up care. With cancer in general, as we know that for the most part, when you do take chemotherapy agents, radiation, biotherapy, following up is very important. That is one of the most important tools that a patient can use once they've been diagnosed, treated, whether they're on maintenance therapy or they were one of those patients who was blessed with remission. So it's always good to do your follow-ups only just in case something was to somehow pop up. It would be able to be found out in a very, very early stage, which is very important. The earlier we detect any types of new cancers, we're able to treat it better.
Yeah, absolutely. Thank you for that question, Big Sis Dula. I appreciate it. You actually kind of led us to the next part of the interview because my first question was going to be, could she share whether you can safely or can care safely continue or resume abroad after starting in the US? And the answer is absolutely, right? I don't want anyone thinking that they are just tied to the US because you started here. A
Mm-hmm.
lot of that depends on the research that you will do, on your mindset, on finances, on time, because you may find a place that's more affordable.
Mm-hmm.
You may find something where it's beautiful, affordable, and offers you so many things in terms of the package that you would not get in the US. But again, when you start thinking about things like insurance, health insurance, once you are diagnosed, it's going to be difficult. Everyone's going to turn you down for insurance. But if you
Mm-hmm.
already have insurance, does that play a role in your reimbursement or your coverage for international care? Typically, it does not cover international care unless maybe you're on a vacation and something happens, but you must check your individual policy to see if you have coverage. I always tell people that before you travel, and this is even for a short vacation, before you travel, if you know you're traveling internationally and you have health insurance, go ahead and contact your health insurance and let them know where you're going and for about approximate amount of time you're going, and tell them you want to know what coverage you have. Whether it's, emergency coverage, do you have coverage for maybe if you need to be transported from where you are by helicopter or whatever it may be, all of those things. And because I have 3 young children, I tend to ask for um, PD, um, pediatric providers in those locations, and I try to stay as close as I can wherever I'm going to the nearest hospital. Right? You just never know. Things happen. But the other thing is, if you don't have, try to get additional insurance too, and it's actually at a fraction of the cost that you would pay for your insurance. And I'm only speaking from the US context. If you happen to have medical insurance that you bought for specifically for abroad, and this is pre-diagnosis. I want to make that clear because once you're diagnosed, it's going to be a lot higher. And I'm not an insurance specialist, so I can't give you figures, but I know that they'll either deny you or it'll skyrocket because you've already been diagnosed for a pre-existing condition. But if you happen to have the insurance, some people tend to keep international insurance if they are traveling quite a bit. Um, that's something that you're going to want to ask. What types of things do they reimburse for? What do they cover? Is it imaging, labs? These are things that you're going to be doing pretty routinely. So you want to make sure that you know what type of cost is involved. And this also helps when you start talking about vetting your global providers as well, because all of that's included in these types of things. You want to know how is that offered on site, or will you have to be sent out somewhere else for labs, for imaging, or is it all a one-stop shop and right there, in addition to the licensing and accreditation of those that are on your care team. Okay. All right, so let's talk about some special considerations. And I'm going to speak specifically for Black women only because this channel specifically educates and informs Black women. We have the highest rates of death when it comes to cancer. It's not only an access issue, although people will lead you to believe that. It is also just being diagnosed late due to biases and discrimination, systemic discrimination in this country. There's a history of that. I wanted to ask you, Dr. Abby, Black women, they have the highest mortality rates in several cancers. What are the reasons behind this? I mentioned a few, but what are some of the reasons behind that?
So it's so frustrating to know that we're in a country where healthcare should be the number one priority. In essence, when it comes to educating the community and just being able to get the care that you need, and it's not what it is. So when it comes to the mortality rate, as you mentioned, it is high. And I have seen, I would say probably on a monthly basis, where the patient is presented to you, and you're, from a medical standpoint, you're thinking to yourself, why didn't this person just, probably if they had showed up say 6 months, a year earlier, things would have been different. They would have had an outcome where, okay, fine, if we could have given probably another 10 years, another 5 years of life. So when it comes to the barriers that those patients face, the availability, again, the accessibility, the lack of education, where it comes to knowing that you need to have a primary care provider, you need to have certain testing. So, for example, you have patients who would come in, and where when you assess that patient, you're like, how did you let this get like that? Why didn't you do something about it? You think about those things. You wouldn't necessarily say to the patient, well, why did you, you know, you're thinking about it, and you're like, this could have been so much better. So a
Right.
big part of it, I believe, is the lack of education, where there's different commercials, infomercials that's done, but I think it needs to be a bit more tailored to our community
Mm-hmm.
so that they're aware. You do not wait until something has become a major problem in your life where it's affecting your activities of daily living, and that's when you realize, oh, I need to get checked.
Right.
So it's
Right.
very important to stress on the idea of, okay, we need to get our primary care providers making sure that certain diagnostic testing, certain certain testing is done just to make sure that we're catching things early. Another very important point when it comes to our community, for those of us we do have insurance. It's so sad when a patient has had insurance for the last 15 years, and you're going to ask, when was the last time you saw a gynecologist? Or oh, I feel perfectly fine. I never had to go. But what a lot of people, whether it's male or female, don't realize, our healthcare insurances also has certain benefits. So, for example, we have a well woman's visit that we can do every single year. People do not take advantage of that.
Right.
So, another example is pap smears.
Mm-hmm.
Some people are under the impression that yes, there is a guideline that says, okay, if you've done a pap smear, it's been normal, you can go every 5 years. No, you should go every year.
Right.
And it's a free service that is given by your insurance. So I strongly believe a big part of it is the lack of education. And second, I would say fear. No one wants
Mm-hmm.
to hear that, oh, I have the big C. No
Right.
one wants to hear that.
Right.
Fear can really cripple someone because it makes you feel like, okay, so you're telling me I'm going to have to go see if I have cancer. Now you start thinking of, what if I do? What is going to happen to my kids? What is going to happen to my life? I have goals, I have aspirations. Everything stops. So that's another factor when it comes to trying to figure out why our mortality rate is on the high side.
Right, right. And this is another reason why medical tourism can be so attractive to others, because then they're seeking care abroad honestly offers more equitable and culturally respectful treatment. There, I can't tell you how many times I've heard someone say they went abroad for treatment and they were like so surprised that a primary care or doctor or a dentist or a cardiologist contacted them via WhatsApp and contacted them after hours. How are you doing? Did house visits, like not at an extra cost. This they just said, I'm coming to see you, and they came to the home or wherever they're staying. All of those things, as long as they had the ability to pay, were just things that they just did, checked on them. So there are a lot of options out there. I love that you mentioned fear and lack of education sometimes prevents us, specifically Black women, but maybe even Blacks on a whole. Because I recently heard a story, I think it was yesterday, where a celebrity. It was a male, a Black male, who was on the Real Housewives of
Yes,
Atlanta.
I
Apparently,
read it,
Dwight
right.
Eubanks. Yes, Dwight Eubanks. Apparently, he has prostate cancer.
Mhm.
Okay, prostate cancer. It is one of the easiest to treat if you find it early. Here was the
Mhm.
issue. He had a history, family history of it. His grandfather passed away from it. He said his grandfather never discussed that he had it, nothing. But he said he wanted to do things differently and he would go and get himself checked out. Now, apparently, he lives with HIV, which I didn't know. So
Yes.
he is constantly checking on his HIV labs and that kind of thing. And he has been going to doctors religiously for it. And some physician told him at some point in his healthcare journey that because the grandfather that passed from the prostate cancer was through his mother, that it's because it's on his mother's side and not his father's side, that he has less of a chance of actually genetically having the prostate cancer. That was one. When it comes to genetics, there's no one size fits all.
Mhm.
So that was the one thing that was a red flag to me, because I would still test normally for prostate cancer. I don't care what anyone's telling me. But again, I'm a patient advocate, I'm a nurse. I would probably do that. But I'm suggesting that no matter what a provider tells you about genetics, still get it tested. Don't wait until later and you may have a problem that's worse than you thought. The second thing was, he said because they were treating him for HIV and they only kind of looked at his
Mhm.
HIV numbers and they were always great. And apparently in 2022, his prostate markers were high. So he has had that at least show up on labs since 2022, but no one realized it until now when he was feeling ill and they tested him for other things, where they said, oh my goodness. Because he said he actually found out through a local health fair. That's why I always praise health fairs, whether it's through a religious community or through a community health center. When they have these health fairs, they uncover so much. These health fairs are so valuable. You find out things that maybe people were unwilling to go into a doctor's office for.
Mhm.
So that is how he found out. So those two things, again, he took the word of the practitioner, told him, oh, it was on your mom's side, so you're probably not going to get it. And then the other thing was, they didn't treat him as a whole patient. You literally looked at his HIV numbers and never looked at anything else, and you could have caught it in 2022. So, Dwight, if you're watching, you have a lawsuit on your case. Call a lawyer.
Yes.
Just saying.
Unfortunately, in his case, they were so controlled about the viral load, which to me
Yeah.
was just an issue only because the medications that are now used for HIV positive patients, it keeps the viral load it's undetected now.
Right. Right.
It's a very low percentage. So when you're just focused on his viral load, knowing that this is not a 20-year-old, a 30-year-old, this man is, I would say, probably in
60,
his
early
late
60s.
50s or 60s.
60s. Yeah.
So at that point, by the time you hit 50, his providers should have been paying attention to
Exactly.
prostate cancer. Also, because he's HIV positive, the new medications are great nowadays, but you really have to pay attention to other types of blood related cancers for HIV patients.
Yeah.
So they were
Absolutely.
only concerned about just the viral load, but
Viral
not,
load.
the whole person, which I
Yeah.
believe when you look at the data, the research from other countries, the care is a lot more personalized.
Yes.
So because the care is personalized, they were able to view the patient on a whole. So you would say that their form of healthcare is a holistic type approach.
Mm-hmm.
Versus here, we're just focused on, okay, we're gonna focus on you have breast cancer, we're gonna focus on breast cancer.
Yeah.
When I do see patients So I'm going to give an example. I had this young lady, she's 32. She has stage 4 breast cancer.
Mm.
She's actively in treatments. I received a call, hey, Abby, you need to come see this young lady. Her blood pressure was pretty high. It very indicative of high blood pressure. And
Mhm.
then on top of it, her blood sugar was 500.
Wow.
And I go in to see this young lady, and you look at her, she has her kid with her, and you think, you're like, wow, this is just so wrong. You're
Mm.
dealing with breast cancer, but then you're also dealing with all these other issues.
Mhm.
And I said to her, I just want to know, have you had anyone say to you about anything in relating to your blood pressure readings, your blood sugar? And she's like, no, um, I'm okay. And I said to her, I'm sorry to let you know, but really and truly, the numbers are not telling me that you're okay. Obviously, as a nurse practitioner, you would assess that patient just to see if there's anything going on, like, is she having a headache? You ask her, do you normally have headaches? Do you have dizziness? You're just trying to get a gist of what's going on with this young lady. And I mentioned to her, so not even the oncologist has said that we need to look a step further, only because we're doing labs every time this young lady comes in for treatments. Now,
Right.
granted, the oncologists, they're very busy.
Mhm.
I would say about a month ago, I had the opportunity to go work with one of our breast specialists. And quite honestly, I was just thinking to myself, this one person has to see a patient every 15 minutes. And
Wow.
that's from 8 a.m. till 4 p.m. How
Wow.
many patients is that? So obviously, her main focus will just be stressing on your breast cancer, what treatment options I have, is the treatment working, what's going on, what side effects are you having from the treatment. So she's not here looking at your blood sugars, she's not
Mhm.
here looking at your blood pressure. And I had to take the opportunity to tell this young lady, okay, these are the complications of high blood pressure. Your blood sugars, obviously a hemoglobin A1C was done, because now we need to see a trend. And I basically told her, you're in a treatment unit at this time, you would need to step out of your comfort zone and go see a primary care physician. And
Right.
obviously, it's based on insurance now. We want you to see an endocrinologist. We want you to see a cardiologist, because you're taking chemotherapy and then you're also dealing with those chronic issues. This is not something that started yesterday. This is
Right.
something that has been ongoing. So that's where I come in, when one of our patients come in and the numbers are just not looking right, and you could
Mhm.
tell that the patient is having a difficult time, now that you're trying to educate them. And one of the issues, they're so uneducated about healthcare in
Right.
general. And she knows she's dealing with cancer, but not realizing she's also dealing with other issues.
Yeah, that is a huge problem. And I'm glad you touched on that because honestly, that is something that is very attractive in other countries. As you mentioned, they look at
Mhm.
the whole patient, it's more personalized. So, what will happen is someone's coming in thinking they're only going to see an oncologist, but that oncologist has already connected with nutrition, connected
Mhm.
with pain management, and all the others, primary care. And you don't necessarily have to go to separate offices.
Mhm.
Everything is one stop shop, maybe just on another floor. And it is part of a package versus a la carte, like in the United States. I wanted to share a couple comments because we have some people commenting in the chat. Big Sis Dula says, to be honest, I fight myself because I have health needs, but do not trust doctors. I want to know what is happening with my body, but fear not being heard again or ignored. And that speaks to the structural or systemic racism in the US, having to fight even just for pain medicine to prove that you need something beyond Tylenol is an issue. I've seen that even just in the emergency department, having to fight for those with sickle cell. going through sickle cell crisis. Tylenol's not going to do it. And they come, and a lot of the physicians behave as if they're drug seeking. We have M. Mahal. Hello, thanks for joining. And she wrote guilty. So she's guilty of just sort of not following through in terms of making sure that they're getting a holistic workup. And then we have, oh, this is a different comment from Charlene Ramontal. Hello, another sister-in-law, Zoe and Chloe, that's our nieces, want to know where the recording studio is. It's bedtime. But no, no, the recording studio, thankfully, is remote.
Yeah.
So Dr. Abby is at home and I'm at home, and
Yeah.
we are able to log into this platform so that we can share this much needed knowledge with everyone. So hi, Zoe. Hi, Chloe.
Hi, Zoe
Um,
and Chloe.
Something I wanted to talk to you about as we round out our conversation that's really important. I wanted you to touch on the support and mental health and how important it is. I wanted you to kind of talk about what role does the emotional support and advocacy play in international cancer care. And I mean, you can even speak for cancer care on a whole, but how can families stay connected and involved when a loved one seeks care abroad, and what you're seeing?
So those patients that have gone abroad, can truly say that when we discussed the holistic aspect of caring, the places that they have gone to, it doesn't only include the patient, it also the patient's family is also involved. So there's
Mhm.
different means of communication, whether they're communicating via the phone, whether they're communicating via WhatsApp, and they do have direct access to the different facilities. There's normally either a coordinator or a representative that they can communicate through, especially if they're traveling to a country where there's that language barrier. So most of those countries would have someone that speaks English that is able to communicate between the providers, the patient, and family. And that happens to be very important. From the mental health standpoint, this is something that I believe that is evolving on our end here as well. Patients are having a very challenging time dealing with those different types of diagnoses, and mental health has become a topic of interest. And there are many times I have actually put in referrals where I'm like, this patient really needs to see someone, this patient needs some type of support. So in my setting at this moment, we do have support groups, which some of the patients will tell you that this is like a lifesaver, only because they're able to connect and communicate with someone who is dealing with the same issues that they're dealing with. They're able to communicate. Also, some of the oncologists, some of the nurse practitioners, they're also part of that support group where they're gonna take different topics of interest to get across to those patients, trying to help them go through that journey. Again, the journey can be very challenging, and there's times where medications have to be prescribed just to help patients as well.
Right.
The patients that I have communicated with that have gone abroad to seek treatment. So, and again, some of our patients have gone to Mexico, they've gone to India, they've gone to Colombia, they've gone to Turkey, they've gone to Europe. They've always mentioned how they feel a sense of relief knowing that they're able to really communicate their needs. They're able to see that they have a whole team to support them through that journey. And you made a valid point earlier where you said the care that is received, it's very inclusive. It's kind of like you went to an all-inclusive resort where
Right.
there's a whole team of doctors and all the interdisciplinary personnel that helps with those patients. Even those patients have a driver. Those patients have someone that prepares meals for them, because nutrition is very important when someone's receiving chemotherapy, radiation, biotherapies, immunotherapies. They have people to give them massages that just to help them relax, just to get through. There is a big part of, they do a big part in music therapies. So I do find that patients that have gone abroad will say that the care has been amazing because they felt very supported. They felt like someone heard them.
Yeah.
One of the important initiatives that my organization has, they have a patient experience team. So
Hmm.
when patients are having a very difficult time, so for example, if a patient came in to me and she says to me, I try to communicate with my doctor about something that is going on and I felt like I was brushed. I am not here to judge. I am not here to say, oh, that wasn't right. Because in the end, I was not part of that communication. I
Right.
wasn't there with that patient. So, what I would typically do is say, don't worry about it. At this moment, I am going to make sure that you're going to communicate with someone who is going to be a mediator between you and your team. So, we
Oh,
would reach out to our patient experience expert, and they would come in and they would communicate with that patient, and they would somehow bridge the gap when it came to trying to resolve the issues that the patient is having. So that has been a very, I would say, a valid tool that was needed to help our patients through the journey.
no, that sounds excellent. And I implore all of you who, whether it's yourself going through that journey or a loved one walking through that journey, that you make sure you advocate for yourself for things like that. You don't have to go at it alone, especially when you are dealing with something so serious, so emotional, on top of other things, right? There is help that's out there, and it's up to you to seek out that help. If you don't feel competent enough, get a patient advocate. That's the type of work that I do. Essentially, a patient advocate helps you navigate the healthcare system. They can communicate with your care team or your providers to ensure that you know your rights, you know your options, you understand your diagnosis. They may not care for you, but they are providing an
Mhm.
environment for you where your care is first and that your wishes are being met. Okay. One of the things I wanted to ask you as we wrap up, Dr. Abby, is in terms of final advice, what's one essential piece of advice for someone just diagnosed with cancer and considering treatment abroad? What would you give them as that one essential piece of advice?
Most important piece of advice is to do your research.
Mm,
Second, make sure that the facility that you're choosing has some form of certification that is well known. So earlier, Dr. Natasha mentioned JACO. There are so many other bodies that work with certifying different hospitals, and also not just the hospitals itself. Some of the doctors are well represented because they've conducted certain research, they've worked on certain protocols that have become like the focus of a certain specialty when it came to the different types of diagnosis. So that would be very important to do your research. And if for any reason you're having doubts, it's okay to see someone here, and then you can go to that specific country that of your choice and you can compare, and
yeah.
then you get to have an idea of, oh, this is very similar to what they're doing, they're using such and such protocol. You do have the right to ask the provider if you're seeking for help here, but really and truly you want to go abroad. You do have the right to say, what protocols are you using? Are they NCI related? Is it, are you focused on the American Cancer Society? What are you using? And ask for the documentation. And then you move over to where you want to seek the care, and then you compare. That will definitely allow you to see, what works best for you. And she did mention the cost. The cost is definitely going to be cheaper. So at least if you know they're doing something similar to what you would get over there, then why not?
Yeah. No, I'm glad you. I hope you guys are taking notes because this is really key to help you if you decide to seek cancer treatment abroad, no matter what stage you are at. I wanted you to also, Dr. Abby, clear up any common myths or misunderstandings that you may have heard, whether it's about going abroad or not. What common myths or misunderstandings would you like to clear up, if any? Maybe there aren't any.
Well, there are in general, persons always believe that pharmaceuticals are trying to, hurt them. And I do believe that over the years, again, I started in 2007 and it's 2025. The pharmaceutical companies, I would say they're doing an amazing job coming up with all those new different treatment options. We have a lot of oral medications now.
Mhm.
In the past, when a patient came in for treatment, I would say 2007 all the way to 2012, we only had, I would say, roughly three anti-nausea meds. Now, there's a slew of anti-nausea medications to help patients get through. So the idea of thinking that, the pharmaceutical companies are just out to get you and make a buck, it's really not about that. Second, it's very important to remember that your providers are also human beings as well.
Mhm.
Um, I'm not going to say that it's fair to make mistakes, but I do want to stress on the point that when you realize something's not right, you have to speak up.
Absolutely.
You have to speak up for yourself. And it's very advisable to make sure that you're utilizing every resource possible. I have to commend Dr. Natasha for coming up with this amazing tool where you can directly come to her site and receive services. Because, quite honestly, when a patient is initially diagnosed with cancer, or probably they had it a couple years ago and they relapsed, it's your judgment is totally clouded.
Yeah.
I do a chemo teaching on a patient and they would come and get treated and they forgot everything that you told them. So if you have someone that can advocate on your behalf, that works wonders because then that person helps you keep things in line when it comes to your health.
Absolutely. Thank you for that. Thank you for that. I always like to give people resources, which we have done throughout this with the Joint Commission. I also want to share a few questions that I think people should use if they plan on vetting any facilities
Mhm.
for cancer care treatment. And Dr. Abby, I'm going to start with some. And if you feel there are additional ones, please jump in and just add. But I would implore you guys to ask, especially depending on the type of treatment you choose, traditional treatment, if you're going to go the chemo, surgery, or radiation, or combination of them, is the treatment aligned with global oncology standards, like Dr.
Mhm.
Abby mentioned, or the NCCN
Mhm.
guidelines? And the NCCN stands for the National Comprehensive Cancer Network. That is a nonprofit. It's an alliance of like the 33 leading cancer centers, and they're
Mhm.
devoted to patient care, to research, and also education. So ask if those organizations are actually adhering to those guidelines. You also want to ask things like, are the providers licensed and are they affiliated with reputable cancer institutions? Are those institutions accredited? And I told you the gold seal is the Joint Commission, or JCO, but the Joint
Mhm.
Commission International accreditation is what you want to look for as the gold seal. Again, academic centers that are aligned with the US academic centers, that should suffice as well. What support systems are in place for follow up or for complications? You're going to want to know all of that before you decide to sign on with any type of provider. Okay. Also, if you're seeking alternative or complementary therapies, more holistic, What is the clinical evidence behind that particular treatment? Everyone is a bit different in terms of their condition, their cancer, that type of thing. But you want to know what type of clinical evidence actually exists behind that particular alternative treatment that you're going to try. Also, how is the treatment administered and how is it monitored for safety purposes for you? You want to
Very
make sure you
important.
have exactly how much information you have on that, and see if you can ask to speak with a patient who has used that particular treatment. It's okay to ask. There are people who are willing to share their experiences. I also suggest, if you go on any type of social media platform, particularly Facebook, only for the groups that have a particular cancer that you're dealing with, you can ask someone what their experience was, if they traveled abroad, or what type of medication they were on, or what was suggested to them, that type of thing, and learn from them and ask them a few questions. It doesn't mean that is going to be the same outcome for you. It may not have worked for them, but it'll work for you, and vice versa. But at least you're having a conversation about it, and it's something that'll help you kind of get a little bit more education on, so you can share it with your providers and start asking those questions of them, right? And then, are there risks of interference with standard therapies? And by that, I mean, if you're talking about alternative therapies, you may have a point where you may have to go back to the traditional. So you do want to know, are there any risks of interference with those standard therapies? So I will just say those are the main things that I would ask you guys to make sure you ask when you are seeking out providers. Dr. Abby, you have anything that you'd like to add to that?
Very important when you're traveling abroad. It's always wise to, if you haven't gone there and you're just going to show up and start treatment, you want to know, are you going to a cancer center or are you going to a hospital? And if you're going to a cancer center, what's the distance between that center, whether it's connected to a hospital, what's the mileage? With treatments, you can have complications, you can have side effects that happens along the way. However, you can have a hypersensitivity reaction. You're in a totally different country, you don't speak the language, and now you're having this reaction, and it's gonna take at least half an hour to get to an actual facility. We don't want that. If you're gonna go to a cancer center to receive treatment, we need to know that we'll be able to get to a hospital the most, I would say, 15 minutes.
Okay.
That's very important because time is of essence. We cannot play around thinking, oh, okay, we do not have time when we have a hypersensitivity reaction. The goal is, I would hope that when they're actually treating you, that they're following the guidelines, the protocols, and that they would have hypersensitivity medications, close by, next to your side. However, if that's not, what they do, they need to be in an area that is very close to a major healthcare facility.
That's really important. I love that. I love that. Anything else that you can think of before we close out?
I would employ anyone to, again, just do lots and lots of research. If you're not happy with, say you went to an oncologist here and you feel like you're brushed off a little, see another oncologist.
Yeah.
The one important, I would say, facts about going abroad, you would be able to get your individualized, personalized, holistic care very quickly. We do have a delay here. We do. So there's times where you might be trying to figure out, what to do. It's not a bad idea if you have the means to go to another country, get those basics done. So by the time you would have done all those basics, since here we have that delay in access and availability, you would have done the necessary diagnostic testing if they had to do a biopsy or whatnot, and then you could have come back and present that to them. I will say that we do accept different biopsies, different diagnostic testing from other countries.
Okay.
when to start coming up with a treatment plan that will be beneficial to the patient.
Do you find that when they do a biopsy abroad, even if they have the actual results and bring them, do they have to undergo another one, or do they accept that and work off of that? Or does it depend on how long ago they had that done?
It depends on the timing. It also depends on the patient's insurance.
Okay.
That's a very big factor.
Got it.
And again, for the most part, those countries that have accreditation, those
Mhm.
countries, they do follow the guidelines.
Got
So
it.
for the most part, I would say at least 80% of patients that have been presented to us with those diagnostic testing, it has been accepted. Now, for follow-up purposes, say they decided to do treatment with us, 3 months down the road, we will do diagnostic testing just to see if the treatments are effective.
Got it. Got it. Wow, this has been so helpful. Big Sis Dula says, "Thank you, ladies." Oh, you're more than welcome.
You're
You're more
welcome.
than welcome.
It was a
Um,
pleasure.
Absolutely. One of the things I wanted to do as we wrap up, I wanted to, I always do a call to action, Dr. Abby. So, Dr. Abby, your guidance today has been invaluable. Thank you for your service to patients and for shedding light on options. So many people don't know that they even have. I want you to give you the option of telling the viewers where they can find you on social media, if you can share your social media with them, and I'll drop it in the chat as well and in the description after we're done.
So currently I am on Instagram, Abby-Moments. I do intend one day to start up a YouTube channel.
Yes, do it.
So hopefully I'll do it before the year ends.
Okay. Yeah, no problem. Oh, and Big Sis Dula says that is important. Some providers want testing at their facility. So thank you for even sharing that. Another thing, I'm going to drop Dr. Abby's IG, her Instagram, in the comments in a moment. I did want to tell you, our viewers, remember, cancer is a diagnosis, it's not a destiny. Right. And with the right support and information, you can chart your own path to healing, and it doesn't have to be tied to the US. Okay. As Dr. Abby said, do your research, compare, and just make sure that you're looking at all options. But you don't have to feel like you're tied to one place. So whether you're newly diagnosed or you're looking for a second opinion, you don't have to figure this out on your own. Again, I said that I'm a board certified patient care advocate, and I'm also a nurse. So here, you can find me at medicaltourismrn.com. I help patients make informed, safe, and empowered healthcare choices globally, whether it's virtual or in person. Okay. So visit medicaltourismrn.com to book your free 15-minute consultation, and let's explore your options together. Also, if you found this helpful, make sure you hit the like button, subscribe, and just share this video. It could actually make a difference in someone's life. Right? So share the knowledge. Knowledge is so important. Make sure you stay informed, stay hopeful, and I'll see you next time. Until then, be well. Thanks, everyone. Stay on, Dr. Abby, if you don't mind. Thanks, everyone.